Good morning, everyone. Welcome to our presentation on Breastfeeding Week 2025. I'm Ms. Kinjal Vasawa, Assistant Professor in Obstetrical and Gynecological Nursing. Today, I will be guiding you through the importance of breastfeeding and its benefits and how we can support the new mothers. We will cover the key themes related to the breastfeeding promotion, challenges, and breastfeeding practice. I am excited to share this valuable information with you all. Let's get started. Today, I want to talk about breastfeeding topic that holds the great importance for the health and well-being of the both babies and mothers. On this slide, you will see that the key point for the discussions. First, we cover the introductions to breastfeeding, what is it and why it's matter. Then we will look the aim of breastfeeding week, which is promote the awareness, support, and educations around the breastfeeding practice. Lastly, I share the theme of 2025, which guides our efforts and highlights the priorities goal of improving infant health and supporting the mothers everywhere. Breastfeeding isn't just a personal choice, it is a vital public health issue that deserves our attention and action. Let's take a closer look some common misconceptions about the breastfeeding. There are many misconceptions out there that can sometimes discourage the new mothers or create the confusion. It's important to understand what's the true and what's not, so we can support the breastfeeding more effectively. Moving on, we will discuss the compositions of breast milk, what actually in it, and why it's so perfectly designed for infant. Then we will explore the numerous benefits of breastfeeding. On this slide, we focusing the introduction. Here, I want to talk to you through the key points in the way both clear and engaging. First, we explore the what the introduction is really about, setting and stage for every that following. It's about stabilizing the context so our audience understand why this topic is matter. Next, we will look at how strong introduction highlights the most important concept right for the start. This helps to capture the attention and keep everyone focused. Finally, I will show you how introductory elements back to overall theme, making sure that everything we'll discuss later makes sense within the bigger picture. Let's take a moment talk about the World Alliance for Breastfeeding Action. World Alliance for Breastfeeding Action is a global network dedicating to promoting and protecting breastfeeding around the world. Their work is crucial and ensuring that mothers have a support and resource they need to breastfeed successfully. Now, an important event organized by WABA is the World Breastfeeding Week. This takes place every year from August 1st to 7th. It dedicated week theme countries and communities come together to focus on importance of breastfeeding. The purpose of WBA is the raise the awareness about the vital breastfeeding is for the health for infant children and mother alike. It's about the highlighting the benefits, then encouraging the policies and practice that support the breastfeeding. This campaign is not just about the education but also about the inspiring the action whenever through the community program, healthcare supports our policies, etc. Today, I want to talk about aims of the breastfeeding week. This special week is designed to promote the importance of breastfeeding for mothers and babies. The main goal is raise to awareness about the numerous health benefits that breastfeeding provide. We want to encourage more mothers to start and continue breastfeeding for as long as possible. Additionally, breastfeeding week aim to support the mother by providing them information and resources they need It's also about the creating supporting environment in communities and workplace. Ultimately, all these efforts tie back to overall theme of improving health outcomes and healthier future for next generation. Let's take moment understand the various reasons behind the promoting breastfeeding. It is the important remind everyone why breastfeeding is so vital for both babies and mother. Not only does it provide essential nutrition and immune protection for the infant, and it is also strengthening bond between the mother and child. And it's equally important to discuss how we can all support the new mothers during this time. Whenever offering the encouragement, sharing the knowledge, or simply being them, collecting the support makes a real life differences. World Breastfeeding Week 2025 is all about every mother receive the help and resources she needs successful breastfeeding. Next point, environmental susceptibility is a crucial aspect of overall health and well-being, and interestingly, breastfeeding play a significant role in protecting our environment. It is a natural food source that require no manufacturing process, no packaging, and no transportations like infant formula does. This means it creates absolutely no waste pollutions or carbon footprint. When we prioritize breastfeeding, we are not just supporting the health of our babies and families, but we are also making the positive impact of our planet. It's very yet powerful act of environmental protections. Let's talk about promoting the health through the breastfeeding. As many you know that breastfeeding is considered the best way to give infant the nutrients they needs for their optimal health survival. It's not about the feeding, it's about the laying a strong foundation for a child future well-being. Our campaign emphasized the number of benefits not only for the babies but also for the mothers. For infant, breastfeeding significantly reduces the risk of many diseases, such as the infection and choice chronic conditions later in life. It is a vital protection factor during those crucial early months. For mother, breastfeeding offers the health benefits this slide encouraging support is really concept of successful breastfeeding. As we emphasized during the World Breastfeeding Week, creating a supportive environment is essential. This means support not just for the families and community, but also from the healthcare professionals and workplace. When everyone is aboard, become much easier for the mothers breastfeeding confidently. The campaign also highlights the importance of policies like paid maternity leave and workplace accommodations. These policies are crucial because they help the mothers to breastfeed for as long as they choose without unnecessary obstacles. Ultimately, this kind of support along perfectly with overall goal ensuring that every mother has the resources and environmental she needs to nourish her baby through the breastfeeding. Let's talk about education and empowerment. Throughout the variety of event and campaign, World Breastfeeding Week focus on the rising awareness among the public. The goal is providing the mothers with the knowledge and skill they need the feel confidence in their breastfeeding journey. By doing so, our aim to normalize the breastfeeding across the all setting, whether at a home, work, or community. This approach not only support individuals' mother but also help to create more supportive environment overall. Remember, education is the powerful tool that empowers the woman and help build a society where breastfeeding is understood and acceptable. Let's take a moment to look ahead the theme of 2025. This slide highlight the key point that will guide our efforts and strategies. next couple of years. It's about setting a clear directions and understanding the core focus areas that will shape of our future success. As we move forward, I want you to keep mind how these themes connect to our real vision and how each can be contribute turning this goal in reality. So let's rewind into the 2025 has stored for us and how we can align our effort to make most this opportunity. For 2025, the theme for Breastfeeding Week is Priority Breastfeeding. Create a sustainable support system. What does mean? We are really focused on building the long lasting support structure for breastfeeding mothers, whether that is our communities at work or within the healthcare setting. It's about ensuring the women have a resources and encouragement they needs to continue breastfeeding comfortably and confidently. This campaign also emphasized that breastfeeding isn't just beneficial for the baby's health, although that hug a part of it. It also natural and environmental friendly way to feed an infant, unlikely the formula. Breastfeeding reduce the pollutions and waste because it doesn't require manufacturing, packaging and transportation. So supporting breastfeeding is a good for the health, our environment and our future. Overall, this theme ties in large message of creating the sustainable, supportive environment that empower the mother, promote their health choice for everyone. Let's take a moment to address some common misconceptions about the breast milk and the mother's body. Often, there are the false idea that can be discourage the mother from the breastfeeding or causes unnecessary worry. For example, some people believe that breast milk isn't enough for the baby's nutrition, but in reality it provides all the essential nutrition a baby need in the first 6 months. Other things that breastfeeding depletes the mother's body of the health nutrients or energy, but with proper nutrition and support mother can maintain their health while breastfeeding. There are also misconceptions that mother's body can't produce enough milk if baby is very large or very hungry, but milk production is primarily dependent on the demand, not the baby size or breast size. Recognizing the correcting this misconception is a very vital help to build the confidence in mothers and support the successful breastfeeding. Breast size doesn't determine the milk supply. First, let's talk about many people believe that first few days of breast milk called colostrum is not enough or even dirty. It is actually very big misconception, especially in some culture. It leads many mother to discard this important initial milk. In reality, colostrum is packed with antibodies and essential for building the body immune system. It is like superfood that give to your baby for stronger start. First, many people think that breastfeeding is always painful, while it's true that some initial tenderness as you and your baby learn to lactation is normal. So little pain is normal. So there is the idea that mother has to eat restricted diet while breastfeeding. That not quite accurate. While maintaining a balanced diet is important for your overall health, most breastfeeding moms doesn't need to avoid specific food. You can usually eat variety of food without worry. Finally, some believe that breastfeeding runs the shape of your breast, not breastfeeding. Factor like your age, genetics, and how many pregnancy you have had much bigger impact. Understanding that the truths help us support new moms better and to spell unnecessary worries. while ties into the overall theme of promoting the confidence and accurate informations about the motherhood. Let's talk moment to address some common misconceptions about the breastfeeding. Many people believe that. Let's take a moment to address some common misconceptions about the breastfeeding process. Many people believe that breastfeeding should be instinctive and easy right from the start. But in reality, it can take a time for both mother and baby to get into the comfortable rhythm. Another misconception is that if the baby doesn't lactation perfectly immediately, breastfeeding is a failure. That's not true. Learning and adjusting are the part of the process. People also often to think that breastfeeding should always be painful, while some discomfort initial is normal. Person's pain can indicate tissue that need attention. These misconceptions can create unnecessary stress and confusion, which is understanding the realistic help us support a new mothers more effectively. Remember, each breastfeeding journey is a unique. Breastfeeding is a natural process for many new mothers. It's actually required a learning and practical skill. It's not always the right way and patience in key. Mothers might need to support from lactation consultants or supporter groups to work together challenges like lactating and positioning. Remember, these difficulties are normal and help is available. Another misconception is breastfeeding must follow a strict schedule. Some think that they need to feed at exact time, but actually feeding on demand when baby shows sign of hunger is usually most effective approach. It helps to stabilize a healthy milk supply and ensure the baby gets enough nourishment. Overall understanding that point can help to reduce the stress and some cultural social misconceptions surrounding this topic. These misconceptions can often show how people perceive and respond to the issue. Sometimes it's a way to hide the process. For example, there are common beliefs that many oversimplify complex relatives or stereotypes. It's important to recognize the misconceptions about breastfeeding in public is inappropriate. In many societies, breasts have become highly sexualized, leading to misconceptions that breastfeeding in public should be hidden. This misconception have been significant impact on mothers. It can cause them feel shame and uncomfortable when they feed to their baby outside of their home. And of course, when mother feel uncomfortable and shame for long, they can avoid the feeding outside. Understanding this societal attitude it's important because it shows how cultural perception can influence the individual behavior and health practice. Overcoming this misconception is a key part of creating a supportive environment of breastfeeding, which ultimately benefit for both mothers and child. Let's talk about some cultural and social misconceptions around the breastfeeding. Many people believe that breastfeeding is just a one person job, meaning only the mother responsibility. While it's true that physically that act breastfeeding is carried out by mother, but the reality is her success depends on the supportive network like family, friends and wider community all play a crucial role in creating an environment that encourage and sustain the breastfeeding. Unfortunately, in some cultures there are the lack of the understanding and support for those around the mother. This can lead increasing the stress, ultimately a shorter duration of the breastfeeding. It is important to recognize that breastfeeding isn't a just physical act. It is also influenced by the some social and cultural factor. By addressing this misconception and more support and understanding, we can help the mother feel empowered and confident in their breastfeeding journey, which essential for both their health and their babies' well-being. This ties in overall theme that creating a supportive environment is the key for successful breastfeeding. Let's talk about some common misconceptions, different culture and society. One of this is the idea that giving a practical feed like sugar, water, and herbal drink is necessary for the newborn. In many cultures, it compulsory to give these liquids within the first few days of the life. The belief behind this is the baby is born hungry or that the substance will help to clear feeding requirement. Let's talk about the benefits of the breastfeeding in next slides. I will explain all the benefits regarding the breast milk for babies as well as the mother and as well as the community. We will discuss all the kind of benefits of breastfeeding in this slide. So here you can see that the benefits for babies. So first one, optimal nutrition. Breast milk is considered the ideal food for the infant. It contains the perfect balance of the protein, carbohydrate, fats, vitamins and minerals, and its composition change as the baby grow to meet their specific needs. The second one is the immune system boost. Breast milk, particularly the first milk called colostrum, is rich in antibodies that protect the baby from the various infections and disease, including the diarrhea, respiratory infections, and ear infections. Okay, moving towards the next benefit of the baby, reducing the health risk. Breastfeeding has been shown to lower baby risk for developing the conditions such as the infant death syndrome, obesity, allergies, and certain childhood cancer. Next benefit is enhancement in the development. So many studies suggest that breastfeeding children may have a higher intelligence score and better cognitive and emotionally development. The breast milk is easy to digest. Baby's immune stomach and intestine. So, baby has a very few digestive issues. So here we discuss all the benefits of the baby about the breastfeeding. Now we discuss about the benefits of breastfeeding for the mother. So first is the physical recovery. Breastfeeding helps a mother's uterus contract after childbirth, which aids its return to its normal size and reduce the postpartum bleeding. Then second one is the reducing the health risk. Breastfeeding lowers a mother risk of the developing a certain disease like breast and ovarian cancer, type 2 diabetes mellitus, and cardiovascular disease. The third benefit for the mother is emotional bonding. Breastfeeding releases the hormone like oxytocin called as a love hormone which strengthening the emotional bond between a mother and her baby. This can also helping in reducing the risk of postpartum depression. Last benefit of breastfeeding for the mother is it is a convenient and cost effectiveness. Breast milk is always ready at the right temperature and doesn't require any preparation or cost for making the milk. It is the convenient and free source of nutrition for the baby. So last we discuss about the benefit of breastfeeding for the society and the environment. So first, it is important for the public health. Promoting the breastfeeding is a smart public health strategy. It can lead the healthier children and mother, which in turn reduce the healthcare costs. Second one is the sustainability. Breastfeeding is the environmental friendly as it produces no waste packaging and pollution associated with the productions and transportations of the infant formula, and it is also economic impact. A healthier populations of the children and mother can contribute to a stronger economy. So in this presentation I share very valuable information. I hope this information is needful. Thank you so much. Have a nice day.